Did you know nearly 1/3 of heart attacks and strokes in seniors are linked to seemingly harmless medications, increasing heart attack risk? Most people assume prescription or over-the-counter drugs only treat symptoms, but the harsh reality is that many cardiovascular risk drugs quietly damage blood vessels, doubling or tripling the danger for high blood pressure seniors. I'm Harold Bennett, and I almost lost my life from an overdose of a common NSAID, unaware of its anticholinergic cardiac effects. In this video, we'll uncover the top 10 medication classes with scientific proof of raising heart attack, stroke, and heart failure risk after age 60. If you or a loved one takes any of these medications, don't click away. Tell us below where you're watching from and which drugs concern you. Hit like and subscribe to join our Living Healthy with Harold community. Stay tuned until the end, because I'll share 3 natural foods for stroke prevention for seniors, boosting circulation and repairing damaged vessels. You won't want to miss it. You might think you know your body, so did I, believing every doctor-prescribed pill was completely safe. I'm Harold Bennett, 76, a former history teacher, living healthily until one morning I woke to severe chest pain and an erratic heartbeat. I had been taking high doses of an NSAID daily for joint pain, unaware it was one of the medications increasing heart attack risk. Initially, I only experienced mild fatigue or shortness of breath when climbing stairs. I blamed my age and accepted it as natural aging. But one day, while reading the paper, my left arm went numb, and my heart felt as though it had stopped. I was lucky not to collapse, but that was my wake-up call. I realized the painkiller I trusted for months could be damaging my coronary arteries. Fortunately, I was referred to Dr. Greg C. Fonarow, MD, a world-renowned cardiologist at USC. Dr. Fonarow, author of over 1,000 studies on cardiovascular risk drugs and heart failure treatment, analyzed my medication history. He explained that my NSAID was inhibiting prostacyclin, the very compound that protects blood vessels, causing coronary artery constriction. Under his guidance, I stopped the NSAID and switched to safer anti-inflammatories plus physical therapy, eliminating the anticholinergic cardiac effects. I also learned to monitor my blood pressure at home and joined a 30-day NSAID-free challenge to restore healthy circulation. Within 6 weeks, my blood pressure stabilized, my chest pain disappeared, and I felt a stronger, more flexible heartbeat. This journey taught me never to underestimate any medication's power, especially when existing heart risks are already present. I share my story so you can spot these hidden cardiovascular risk drugs early and find safer alternatives to protect your life. Next, we'll dive into the first drug class, NSAIDs, the leading cause of coronary damage in seniors. Think painkillers are harmless? Every time you swallow an NSAID, you may be feeding one of the most common cardiovascular risk drugs that silently damages your heart. A JAMA study found that seniors who use NSAIDs daily had a 20% higher risk of heart attack within a year. NSAIDs work by blocking COX-2 enzymes, reducing prostacyclin, the natural compound that keeps blood vessels open and prevents clotting. Without enough prostacyclin, your arteries constrict and platelets stick together, turning a simple pill into a serious medication, increasing heart attack risk. I remember one humid afternoon, I was on my regular walk to control my blood pressure when a sharp chest tightness struck me out of nowhere. It hit me then that the morning's painkiller had eroded my coronary protection from within. Diving into the American Heart Association guidelines, I learned that NSAIDs not only relieve inflammation but also block essential prostaglandins needed for healthy circulation, especially dangerous for high blood pressure. Harvard research in 2015 showed NSAIDs elevate CRP, a key marker of vascular inflammation linked to acute cardiac events. The AHA now warns that these drugs should be used only short-term in seniors. If you've been reaching for NSAIDs daily, try a 7-day challenge, switch to massage, hot packs, or deep breathing exercises instead. You'll likely feel steadier blood pressure and a gentler heartbeat. For the full list of top 10 drugs to avoid after 60, download our PDF in the description and join the Living Healthy with Harold Facebook group today. Did you ever think a sleep aid could be quietly overworking your heart? Benzodiazepines like Valium and Xanax are prescribed for anxiety and insomnia, yet they rank among the most dangerous cardiovascular risk drugs. A BMJ study found that seniors on benzodiazepines for over 3 months face a 30% higher risk of heart attack and stroke. These drugs boost GABA activity, slowing brain signals, but they also cause blood pressure swings and blunt heart reflexes. I remember taking a nighttime diazepam dose to relax, only to wake with a racing, then fluttering heartbeat. That very pill misled my brain into calm while forcing my heart to struggle in silence. Harvard research in 2017 confirmed that long-term benzodiazepine use is linked to acute cardiovascular events. The AHA now advises limiting their use in high blood pressure seniors, recommending non-drug relaxation techniques instead. If you rely on these pills, try a 5-minute guided meditation or calming music session tonight. You might find your heart and blood pressure steadier than ever. And don't forget to download our PDF, Top 10 Drugs to Avoid, for safer alternatives, and join the Living Healthy with Harold Facebook group to share stress reduction tips. Proton pump inhibitors have earned a reputation as the heartburn savior, but they hide a dangerous secret: they're one of the most potent cardiovascular risk drugs on the market. A large German cohort study of over 73,000 seniors revealed that regular PPI users face a 44% higher risk of stroke and other cardiac events. By suppressing stomach acid, PPIs interfere with the absorption of magnesium and vitamin B12, nutrients essential for maintaining healthy heart muscle contractions and stable electrical signals in the heart. Imagine this: you pop your morning PPI to stop acid reflux, but inside, your coronary arteries are quietly starved of key minerals. I experienced the warning signs myself: dizziness and an irregular heartbeat soon after taking my pill. At first, I dismissed it as a mild side effect until I discovered that magnesium deficiency is directly linked to dangerous arrhythmias and coronary spasms. A 2015 neurology study confirmed that seniors on long-term PPIs had significantly lower B12 levels and a marked increase in cardiovascular events. The American Heart Association now advises healthcare providers to reassess PPI prescriptions after just 4 to 8 weeks and to prioritize non-drug measures, like a low-acid diet and H2 blockers, before continuing long-term PPI therapy. If you're relying on PPIs, consider natural alternatives tonight. A cup of warm ginger tea or a spoonful of honey lemon can soothe your stomach without robbing your heart of vital nutrients. You'll be giving your circulation and your brain a break from the hidden dangers of these drugs. Last week, my 78-year-old neighbor Edith, who never misses her afternoon park stroll, suddenly felt her heart skip and flutter just 15 minutes after taking Benadryl for relentless sneezing. She ended up in the ER with a dangerous arrhythmia triggered by the strong anticholinergic effects of first-generation antihistamines, one of the most underestimated cardiovascular risk drugs. A JAMA internal medicine study revealed that seniors using diphenhydramine or chlorpheniramine daily for 3 years face a 54% higher risk of dementia and serious cardiac issues. But their impact doesn't stop at the brain. These drugs also promote coronary spasms and disrupt heart rate variability, putting high blood pressure seniors at acute risk. Next time allergy season hits, swap that diphenhydramine for a second-generation option like cetirizine or loratadine. You'll still breathe easily without inviting a hidden threat to your heart. In the next segment, we'll uncover how antipsychotics prescribed to older adults can double their chance of a sudden heart attack. Harold once shared the story of his 82-year-old friend Gene, an ex-serviceman who was sharp as a tack until insomnia and grief led his doctor to prescribe antipsychotics. Within weeks, Gene became lethargic and one morning collapsed with signs of a heart attack. A CT scan confirmed ischemia from compromised coronary flow. Drugs like risperidone and olanzapine may calm agitation, but they rank among the most dangerous cardiovascular risk drugs for high blood pressure. By altering dopamine and serotonin levels, they can trigger tachycardia, blood pressure swings, and dramatically raise the odds of both heart attacks and stroke. A Lancet Psychiatry meta-analysis found that seniors over 75 on antipsychotics for more than 12 weeks faced a 60% increase in cardiovascular mortality. The FDA also issues black box warnings about sudden death and strokes in elderly dementia patients taking these medications. As Harold advises, when antipsychotics are unavoidable, use the lowest effective dose, under strict cardiology supervision, with frequent blood pressure checks. Coming up, the ultimate silent threat, anticholinergic combination drugs, that make stroke prevention for seniors an urgent, non-negotiable mission. One afternoon, Harold recalled his 79-year-old friend Mary, who mixed a diphenhydramine cough syrup, a scopolamine anti-nausea tablet, and a sleeping pill all at once. The next morning, she woke up unable to remember how to get home, with her heart racing and blood pressure soaring. This is the hidden threat of anticholinergic combination drugs, pills that combine multiple acetylcholine blockers in a single dose. By depleting acetylcholine levels, they attack both the brain and the cardiovascular system, causing acute memory loss, arrhythmias, and doubling the risk of stroke and heart attack in high blood pressure seniors. A 10-year study of over 3,400 older adults found that those with high cumulative anticholinergic use had a 54% increased risk of dementia and cardiovascular events. Before combining any medications, check labels for diphenhydramine, scopolamine, or atropine, and ask your doctor for safer alternatives. In the final segment, we'll reveal the top 10 drugs to avoid after 60 and share essential stroke prevention for seniors. Don't miss it. Last week, Harold recounted his friend John, a 75-year-old Navy veteran, who took a dose of Valium to calm his chronic anxiety. The next morning, John collapsed on his porch steps with sudden low blood pressure and a dangerous arrhythmia triggered by the diazepam he'd taken the night before. Medications like Valium, Xanax, and Ativan are often viewed as quick fixes for anxiety and insomnia, but for high blood pressure seniors, they carry serious hidden risks. By boosting GABA activity, these drugs immediately calm the mind, but they can also suppress heart rate, cause abrupt blood pressure drops, and weaken cardiac muscle function. A BMJ analysis found that seniors using benzodiazepines for more than 3 months faced a 51% higher risk of Alzheimer's disease. Research in the Journal of Cardiology also reported a 35% increase in hypotension and arrhythmias among older adults on these medications. Instead of reaching for a pill, try dedicating 10 minutes each morning to deep breathing or mindfulness meditation. You'll calm your nerves without compromising your heart. Next up, we'll explore how common proton pump inhibitors may silently deplete magnesium and double the risk of stroke in older Americans. Last week in Chicago, 68-year-old Margaret started complaining of persistent fatigue and dizziness every time she stood up. She'd been taking omeprazole daily for years to manage her acid reflux. A recent blood test revealed dangerously low magnesium levels, accompanied by irregular heartbeats and fluctuating blood pressure. Proton pump inhibitors like omeprazole, esomeprazole, and pantoprazole might soothe your stomach, but they can silently rob your body of critical nutrients such as magnesium and vitamin B12, both essential for nerve function and a healthy cardiovascular system. When magnesium runs low, blood vessels are prone to spasm, the heart's rhythm becomes unstable, and the risk of stroke and heart attack among high blood pressure seniors climbs dramatically. A German study of over 73,000 older adults found that regular PPI users faced a 44% increased risk of dementia and a 32% higher risk of stroke compared to non-users. Another analysis in clinical gastroenterology and hepatology showed that chronic PPI use raises the odds of arrhythmias and angina by 70%. Instead of relying solely on PPIs, consider lifestyle tweaks, cut back on coffee, alcohol, and spicy foods, and boost your intake of leafy greens and whole grains. If heartburn persists, talk to your doctor about intermittent PPI therapy or switching to an H2 receptor blocker. Next, we'll uncover how Z-drugs, commonly prescribed sleep aids, could be quietly undermining both your brain and your heart. Dike Sang Tiang An, Kio Leo Long Tu Qua Veo Cho An, Zoa Kak Nan Noi Dung Trong Voice Text, Hook Mo Dao, Dien Bien Ka Chuyen, Chao Treo, Learn, Authory. Last month, I took my usual dose of zolpidem, just like my friend Robert, a 72-year-old retired teacher in Seattle. I slipped into what felt like a deep sleep, only to wake up hours late, are confused, heart racing, and blood pressure soaring. Z-drugs such as zolpidem and zaleplon are prescribed to induce sleep by dampening certain brain circuits. While they help you drift off, in high blood pressure seniors, they also interfere with natural REM and deep sleep cycles, preventing your body from properly regulating cardiovascular function overnight. This forced sleep lacks the restorative quality needed for memory consolidation and vascular health. A large study published in the BMJ found that older adults using Z-drugs chronically experienced a 45% greater risk of cognitive decline and a significantly higher incidence of falls and related injuries. Each disrupted sleep cycle triggers spikes in stress hormones like cortisol, which narrows blood vessels and increases the risk of both stroke and heart attack. For better stroke prevention for seniors, replace nightly Z-drugs with non-pharmacological habits. Practice mindfulness meditation or gentle deep breathing for 10 minutes before bed to calm your mind. Maintain a strict sleep routine, going to bed and waking at the same time daily, to support your circadian rhythm. Create a restful environment, cool room temperature, blackout curtains, and no screens an hour before sleep. By restoring natural sleep architecture, you protect both your brain's memory centers and your cardiovascular system, helping you stay sharp and safe without the hidden dangers of Z-drugs. Last spring in Houston, I sat with my friend Linda, a 70-year-old widow who'd been prescribed amitriptyline to ease her depression and insomnia. At first, she felt a slight lift in mood, but within months, she began forgetting simple things, missed doctor appointments, confused medication schedules, and a persistent brain fog that made her feel lost in familiar places. Tricyclic antidepressants like amitriptyline and doxepin block the neurotransmitter acetylcholine, which is essential for memory and learning. In older adults, this reduction can accelerate cognitive decline, increase the risk of dementia, and place added stress on an already vulnerable cardiovascular system. According to a 2015 JAMA study, seniors using strong anticholinergic drugs for over 2 years faced a 37% higher risk of dementia compared to non-users. For true stroke prevention for seniors, consider pairing therapy with non-drug approaches. Mindfulness meditation, gentle deep breathing, and community support groups can help manage depression without sacrificing brain health. By reducing reliance on tricyclics, you protect both your mind's clarity and your heart's resilience. Last winter, my neighbor Mary, 74, in San Diego, began taking oxybutynin for an overactive bladder. Within months, she noticed frequent memory lapses, forgetting grandchildren's names, losing track of her heart check appointments, and struggling to follow simple news articles. Medications like oxybutynin and tolterodine are powerful anticholinergic drugs that block the neurotransmitter acetylcholine throughout the urinary tract, and in the hippocampus, the brain's memory hub. Chronic use has been linked to accelerated brain atrophy in regions responsible for memory and learning. A study at UCSF found that seniors on high-dose anticholinergics faced a 54% greater risk of dementia. Moreover, this silent loss of acetylcholine contributes to brain fog, impaired concentration, and increased fall risk, all factors that undermine stroke prevention for seniors. Instead of relying solely on these pills, consider pelvic floor exercises or a referral to a urology specialist. By reducing your anticholinergic load, you protect both your bladder control and your brain's long-term health. Here's a concise recap of the 10 medication classes that can undermine stroke prevention for seniors and brain health. 1. Anticholinergic combinations, cold remedies, muscle relaxants. 2. Statins, atorvastatin, simvastatin. 3. Bladder control drugs, oxybutynin, tolterodine. 4. Tricyclic antidepressants, amitriptyline, doxepin. 5. Z-drugs, zolpidem, zaleplon. 6. Antipsychotics, risperidone, quetiapine. 7. Proton pump inhibitors, omeprazole, esomeprazole. 8. Benzodiazepines, Valium, Xanax. 9. First-generation antihistamines, diphenhydramine, Benadryl. 10. Barbiturates, phenobarbital, secobarbital. Although each of these can address specific issues, their long-term effects, blocking acetylcholine, reducing essential brain cholesterol, or chronically depressing neural activity, are linked to accelerated cognitive decline, brain fog, and higher dementia risk. Blood pressure dysregulation, raising stroke and heart attack chances in high blood pressure seniors. Increased fall risk and delayed recovery post-stroke. Here's what you can do right away. 1. Review your prescriptions with your doctor or pharmacist. Ask about dosage adjustments, treatment duration, or safer alternatives to protect both heart and mind. 2. Embrace non-drug strategies to boost stroke prevention for seniors. Mindfulness and deep breathing, 5 to 10 minutes each morning, to lower stress, stabilize blood pressure, and enhance cerebral circulation. Sleep hygiene, keep consistent wake-up and bedtime hours, avoid screens at least 1 hour before sleep. Gentle exercise, a daily 15-20-minute walk, yoga, or Tai Chi supports vessel flexibility and reduces arterial strain. Brain protective nutrition, prioritize foods rich in omega-3, magnesium, vitamin B12, and leafy greens to strengthen neurons and prevent brain injury. 3. Monitor your health regularly. Check and log your blood pressure each morning to spot early warning signs. Test vitamin B12 and magnesium levels if you're on PPIs or statins, since nutrient deficiencies can worsen brain health. Remember, prevention always beats a cure. By taking small, consistent steps every day, you'll build a healthier heart and a sharper mind for years to come. If you found this helpful, please like, share, and subscribe so more families can benefit from these insights. I'm Harold Bennett, wishing you strength, clarity, and well-being.